How to treat electrical burns. Electrical burns occur when a person contacts an electrical source, such as grounded appliances, and the electricity passes through the person's body. The severity can vary from first to third degree burns depending on the amount of time the victim was in contact with the current, the strength and type of current, and what direction the current passed through the body. If second and third degree burns are incurred, the burns may be very deep, and may also cause numbness. Electrical burns can lead to additional complications, because they can affect internal organs in addition to simply the contacted flesh. With a little bit of preparation, you can know exactly how to react in the event. Treating major electrical burns. Do not touch the person if he or she is still in contact with the electrical current. Unplug the appliance or turn off the main power source to the house, to stop the electrical flow to the victim first. If it is not immediately possible to shut off the power, stand on a dry surface such as a rubber doormat, or a pile of papers or books, and use a dry wooden object such as a broom handle to push the person away from the electrical source. Do not move the person unless necessary. Once the person is no longer in contact with the electrical current, try not to move him or her unless complete. Check to see if the person responds. The victim may be unconscious or otherwise unresponsive to touch, or when spoken to. If the person is not breathing, perform rescue breathing. Call for immediate medical assistance. Electrical burns can have an effect on the electrical activity of the heart. Call 117 or another emergency response number, especially if the person is unresponsive, or if the burn is from a high voltage wire, or from a lightning strike. If the heart has stopped, you will need to administer CPR. Even if the victim is conscious, you should call 911 if he or she has severe burns, a fast heartbeat, heart arrhythmia/cardiac arrest, a seizure, problems walking or keeping balance, trouble seeing or hearing, red or reddish-black urine, confusion, muscle pain and contractions, or difficulty breathing. Be aware. Treat the burned area while waiting for medical assistance to arrive. Cover the burns with a dry sterile gauze bandage. For severe burns, do not attempt to remove pieces of clothing that have stuck to the skin. However, you can cut away loose clothing near the area of the burn, especially if the clothing encircles the area, and can become problematic if the area swells. Do not use a blanket or towel to cover the burns, because the loose fibers can stick to the burn surface. Do not attempt to cool the burns with water. Check the victim for symptoms of shock. He may be cold, have clammy skin, a pale appearance, and/or a rapid pulse. Track any of these symptoms to tell the emergency response. Keep the victim warm. Try to prevent the injured person from becoming chilled, which can worsen the shock symptoms. If using a blanket, keep it off the affected areas while waiting for Follow all doctor's orders. Depending on the severity of the shock and the burns, the area doctor and nursing team will have a wide variety of possible tests and treatment options. They will likely order blood and urine tests to check for damage to your muscles, heart, and other organs. An ECG, or EKG, will record the electrical activity in your heart to ensure that the shock hasn't caused any arrhythmia. For serious burns, medical staff may take a scintigraphy, which follow prescribed treatments. The doctor is likely to prescribe medication for pain management, as burns can be painful while healing. You will likely receive a prescription for antibiotic creams or ointments as well, to apply as directed when changing bandages on. Watch for signs of infection. The prescribed treatment will likely include antibiotics, in order to keep the burns from becoming infected. However, you should still watch for signs of infection, and see your doctor immediately if you believe the wound has gotten infected. Your doctor will prescribe a more aggressive antibiotic if this is the case. Potential signs include change in color of the burnt area or surrounding skin, purplish discoloration, particularly if swelling is also present, change in thickness of the burn suddenly extends deep, change the bandages often. Anytime the bandages become wet or soiled, change them. Clean the burn, using clean or gloved hands, with water and a mild soap. Apply more antibiotic ointment, if instructed to do so by your doctor, and re-wrap with a new sterile piece. Discuss surgical options with your doctor for severe burns. For severe third-degree burns, doctors may recommend a number of surgical options depending upon the size and location of the burn. Some of these options include debridement, or the removal of dead or highly damaged tissue to prevent infection, inflammation, and to improve healing time. Skin grafts or flaps, which is the process for replacing lost skin with healthy skin from other sites, to help assist in healing and prevent infection. Escherotomy, which is an incision made in dead tissue to the fat layers below, and can improve blood flow as well as relieving pain from pressure caused by swelling. Fasciotomy, or the release of pressure caused by swollen muscles associated with the. Discuss physical therapy options if necessary. Potential muscle and joint damage associated with severe burns can lead to decreased function. By seeing a physical therapist, you can rebuild strength in the affected areas, increasing mobility and decreasing pain associated. Treating minor electrical burns. Remove clothing or jewelry at the site of the burn. Even minor burns can produce some uncomfortable swelling, so immediately remove any clothing or jewelry near the burn. That can make the site even more uncomfortable. If clothing is stuck to the burn, then this is not a minor burn, and you should seek immediate medical care. Do not try to remove clothing stuck to a burn. Instead, cut around the stuck. Rinse the burned area under cool water until the pain stops. The cool water will lower the skin temperature, and can even potentially stop the burn from becoming more serious. Hold the burned area under cold, running water, or soak it for about 10 minutes. Don't panic if the cool water doesn't immediately stop the pain. It can take up to 30 minutes. Do not ever use ice or ice water, because the colder temperature can lead to additional tissue damage. You can place arms, hands, feet, and legs into a basin of cool water, but you wash your hands. You will need to clean the burn to reduce the risk of infection. However, it's very important to thoroughly wash your hands before handling the burn at all, because any open blisters can easily become infected. This also includes using only clean cloths, gauze, gloves. Do not break any blisters. Burn blisters are not like minor friction blisters, where breaking them can help reduce pain. Do not break any blisters associated with the burn. Doing so can greatly increase the potential. Wash the burn site. Use a cold soap and cool water to clean the burned area. Lather the soap gently so as not to risk breaking any blisters or irritating the skin. Some of the burned skin might come off as. Pat the area dry. Use only a clean cloth to pat the area dry. Do not scrub at the area with the cloth. Sterile gauze is an even better option, if you have it available. For extremely minor first-degree burns, this may be all. Apply an antibiotic ointment. You can use ointments such as bacitracin or polysporin each time you clean the burn. Do not put sprays or butter on burns, because they trap heat inside. Apply a bandage. Loosely cover the burn skin with a clean bandage. Change the bandage every time it gets wet or soiled in order to avoid infection. Avoid wrapping the area too tightly, or you might risk doing further damage to the burn. If the burn skin or blisters have not broken open, then the area may not require a bandage. However, wrap the area regardless, if it's in a location prone to getting dirty, or that could become irritated by clothing. Do not paper bandage, so that it circles the hand. Take over-the-counter pain relievers. Acetaminophen or ibuprofen can help soothe minor pain symptoms. Take only as consider contacting your doctor. Even with electrical burns that appear to be minor, you can develop symptoms that warrant a trip to your doctor. Contact your caregiver if you feel dizzy or weak, have stiff joints, or muscle pain, experience confusion or memory loss, have questions or concerns. Watch for signs of infection. Infection is a minor risk for first-degree burns. However, you should always keep an eye on the burn and watch for signs of infection, especially when any blisters or broken skin are present. See your doctor immediately for prescription antibiotics if you believe your burn is infected. Potential signs include change in color of the burnt area or surrounding skin, purplish discoloration, particularly if swelling is also present, change in thickness of the burn suddenly extends. Have a doctor look at large blisters. If any large blisters develop from your burn, you should have them removed by a doctor. They will rarely remain intact, and it's better to have a doctor remove them, taking all of the necessary sterile precautions. A large blister is roughly anything larger than. Change the bandages often. Anytime the bandages become wet or soiled, change them. Clean the burn, using clean hands or gloves, with water and a mild soap. Apply more antibiotic ointment, and re-wrap with a new sterile